greetings, and this is our entire panel. And before we go on, I do have a little something that I want to share with everybody. So, today, as you know, we always come back to Oral Pathology 360 for many different things. And one of those many things, of course, is our competitions and times where we just do different things and do things differently, essentially just to ensure that, the interest is always there, and the dynamism is always there. A long time back, someone told me when we had just started that this channel makes us feel like rock stars, and that's the exact feeling that I want to continue, and for everybody to, whether they are watching or they are attending or they are participating, because you are the rock stars of oral pathology, oral medicine, anything that is within the oral and maxillofacial diagnostics. So, of course, to tell you a background of why the open mic, there were two. This is the second one. And as you might have noticed, of course, from all the advertisement going on and all the social media share, is that two people, one from each event, is going to be a guest speaker in the Rising Stars session of the conference. Now, the conference itself is the International Oral Diseases Case Presentation Conference from the May 3rd to 5th, and this is the third conference that we are organizing. It's a fully virtual conference with a lot of very interesting key things that happen there. Of course, there is the regular things like the keynote and the guest lectures. Then we have case presentations, because normally, as we know, case presentations don't get the kind of interest and the emphasis that research gets. But case presentations are finally what we learn from as far as the practice of what we do and not just the theory goes. So we have a case presentation conference. Cases, you can present your cases, you can present case series both as oral presentations or as posters, and there are prizes in both categories. Then we will have discussions, and of course, we always have experts around for the case discussions to comment on the cases. We have networking. This is the one thing about a virtual platform is it gives you excellent networking. You can do an immediate video chat with anyone. You can send them a request. You can set up a calendar meet. You can basically just send them a message so they know who you are and they will catch up with you later. We have special sessions on technology updates where you're going to see the latest and the best, especially with a focus on work that is done by entrepreneurs who are from among us. So the equipment or the technology that they are bringing out, they will introduce to you for 10 minutes each, and we will have a few of those. Another thing is it is in multiple time zones. So wherever in the world you are, you will get some sessions that you will see live and you will take part live, but of course some of it you will watch as a recording, and then the whole thing is recorded and you can watch it for 15 days afterwards. And all the abstracts will be presented or published in an ebook with an ISBN, so you have that. But since it's an abstracts book, you can still go ahead and publish your cases. That's not a limitation to that. And it is for really anybody who has an interest in the oral and maxillofacial diagnosis. So, literally, absolutely anybody is welcome to take part and to present. And these are the wonderful people who are helping us. And actually, there are four that are still missing that I need to add there, but we have an entirely global presentation. And every certificate that you get and your co-authors who are registered get will also have all the logos. So it is essentially sanctioned and respected and provided by all of these. So, right, registration is open, abstract submission is open. Please go and take part. We do hope we will see you there. And also, equally important, share it with others. Right. So, with that, let me stop this share. Yes. And let me once again say welcome to our very wonderful participants who I must say I appreciate the dynamism, the go and get attitude, and I do hope and wish all of them the best. For the voting, please note that it is on the top of the chat. You will see a tinyurl.com OP360 open mic. That's the URL for the voting. The voting must have just opened, or maybe it'll open in 15 minutes. I actually can't remember what is the timing I've set. Anyways, and you will have to vote for everyone. The voting is straightforward. It is stars. You give each one anything between 1 to 5 stars. And as might be obvious, five is the best. Okay, so you give people a 5 stars, you definitely liked what they presented. And the voting will be open for some time after the session, simply because some people will not be watching it live or will be catching up with us a little live. Another thing is, today you may find that when you join and you start watching, you may watch right from the beginning, and that may be because I have changed the settings so that you watch from the beginning and see all the presentations. With that, let's go on to our first one. So the first one is by Dr. Gowthami. Dr. Gowthami, where are you?
Yes, ma'am,
Yes,
I'm here.
yes. So would you want to introduce yourself,
Yes,
please?
of course, ma'am. Good evening, ladies and gentlemen. Thank you so much for this opportunity. I'm myself, Dr. Gowthami Jawahar. I'm the founder and CEO of Cellotron. As you already said, ma'am, I'm doing difference in that though I have a pathology background, I still, jumped into an entrepreneurial journey, and I'm the leading the company, and we are into animal tissue models and bioprinter manufacturing company. We are in the early stage. I would like to take this stage, to showcase my company to our forum. So it will be, recognized by among all of us. And
Yes, I think
all
you
the
have
best
done
for.
exactly that at the end of your video. So let's just go watch it. Okay.
Yeah,
Yeah.
yeah.
Okay.
Thank you. All the
Okay.
best for everyone.
Yes.
Thank you.
I think I'm going to request now everybody else to put off their cameras and put off their mics. So yeah.
Good afternoon, ladies and gentlemen. I'm here to talk about advancements in drug testing, especially for oral tissue models utilizing 3D bioprinting technology. Day to day life, we face a lot of problems. A patient has to be really, really lucky in order to get the treatment. Now, why do I say this? Because 20 years back, when my grandmother was affected with breast cancer, unfortunately, we lost her because we were not able to give her the proper treatment. Now, why this story comes in here? There is high cost and lengthy process for the drugs to reach the patient. 9 out of 10 drugs fail in the clinical stages. So again, this 9 drugs has to go back from the first square. And secondly, animals are the poor indicator for a successful human drug development. And because they don't carry the human physiological properties. Why do we have to take these issues into consideration? Most of the drugs are identified through an accident. Now, after identification, in order to reach the market, it takes around 10 to 15 years. This is it's a huge roadmap. And thanks to certain, development like bioinformatics, wherein we are able to identify the lead component, and roughly around 5 years is being reduced. Again, 10 years. Can we solve this problem? Yes, of course. Biology and technology. Together, we call this as a bioconvergence, which is going to be the future of healthcare technology. How do we do this? We have classical tissue engineering technology, 3D bioprinting, organ on chip, and organoids. Now, how do I design my oral tissue model? I take a membrane and I want a cell of origin. The cell will be the pulpal stem cell. And after putting all these together and culturing, we get something like this, a structured oral epithelium, which is derived from the pulpal stem cells as well as the membrane. Is it really going to be possible? Yes, we are Cellutron and we are doing robotic bioprinter as well as bioink. Our ultimate aim is to repair, replace, and regenerate. We have a fabulous team, and I'm Dr. Gowthami, who is the founder and CEO of this Cellutron. And we have two different teams who are involved in manufacturing bioprinter and manufacturing bioink. I am taking care of the bioink development, and along with me, Dr. Shashank Shetty, who is also our advisor and CTO from Stanford University. And bioprinter has been designed by Dr. Pradeep Kumar and Dr. Samuel Vail, who are PhDs in mechanical engineering and has 10 plus years of experience working with German Aerospace Center and NREL labs. So this is our team who's going to make this possible. And the market for this tissue models are high. If you just take around the world, it's around roughly 1.4 billion. And in India, it's about 80 million. Now, why do I put these numbers here? Because there's always a potential area of development, and India has to, compete with the world, and we are there to solve this. Throughout the world, I have competitors, huge competitors who are doing all these works around the world. Now, how do I stand out? Because I do produce the bioprinter as well as humanoid bioink. We have three patented technology from our company. One is going to be the indigenous dual bioprinter, which has been excellently designed by our team. And secondly, the method of bone scaffold production. And third is the humanoid tissue models. So all these things are yet to be patented from our side. So this is the development which we have made for the bioink. This is a stem cell culture, stem cell culture from the pulpal tissue, and the 3D culture has been carried out in our laboratory. And this is the video to play. Dr. Sam is, demonstrating how the printer is working in case of the bioprinter development. And this is the prototype which we have. And feel free to contact me. This is my number and email ID. And thank you so much, Dr. Mandana, who's CEO of Oral Pathology 360, for giving me this opportunity to showcase my company in this forum. And we're also supported by Startup TN and DST. And currently, we are incubated at Crescent Innovation and Incubation Council. Thank you so much.
Yes, thank you, Dr. Gowthami. Right. Yes, our next presenter is Dr. Abhishek Bhadranna. And what would you like to say to start off?
I'm Dr. Abhishek Bhadranna. I represent three verticals here. I'm a dental clinician, and we run a Dr. Bhadranna's Oral Pathology, where we get the tissues to report on, and a small startup called 91 Danta Research and Product Development with a patent pending product. Thank you.
Yes, thank you, Dr. Bhadranna. So let's and for everybody voting, please don't get confused. Look at the photos. We do have two Dr. Abhisheks today. So just be mindful of that. And I will just share the first Dr. Abhishek Bhadranna's video. Right.
Hi, I'm Dr. Abhishek Bhadranna speaking about oral microbiome and its role in systemic health. What is a microbiome? Microbiome is a community of microorganisms that are resident to our body. And oral microbiome is nothing but the community of microorganisms living inside our mouth. They can be symbiotic, like the gut bacteria, which helps in vitamin K2 production. They can be commensal, like the Streptococcus salivarius on the tongue, and pathogenic. They can be like the Streptococcus mutans, the pioneer bacteria of dental caries. The oral microbiome is one of the most complex, important microbial communities that are being studied. They are part of these 5 research priorities according to the Human Microbiome Project. Microorganisms can be a bacteria, fungi, protozoa, algae, helminths, viruses, and also prions. And imagine the more research has gone on bacteria, viruses, there may be hundreds of them which we don't know also, or millions of them. 1 gram of plaque has 2 to the 10 to power 11 microorganisms, 200 billion of them, and around 700 kinds of microorganisms that are colonized inside the human oral cavity. In 1891, Dr. W.D. Miller, our first oral microbiologist, he postulated the theory of oral infections, oral focal infections, which according to it can affect other parts of the body related to a variety of systemic infections. Frank Billings also speculated that infection of the teeth may be cause of rheumatoid arthritis, nephritis, endocarditis, and other diseases. From 1891 to now, there has been a lot of research and there has been association between oral microbiomes and a variety of human chronic diseases. For to say cancer, Alzheimer's diseases, inflammatory bowel syndrome, bowel diseases, preterm birth weight of the babies, diabetes, rheumatoid arthritis, cardiovascular disease. Frankly, that's involving all the parts of the body. I'm not going to speak about the mechanism involved here. I'm not going to speak about how periodontal inflammation can lead to other diseases in the body, but I'm going to speak about a theory that I have because it's an open mic. Let's take a detour. In 2009, there was a famous movie called Avatar. Here in Avatar, there is a huge tree called Tree of Souls, okay, where avatars used to sit and pray there. And this was very close to Iva, which was the goddess protecting the planet of Pandora. Okay, very interestingly, all the avatars had a projections from their hair, and that would get connected to any animal or any tree, like the Tree of Souls, where they had a connection to make with them. And when they died too, they were buried near the Tree of Souls, and the roots would engulf them and they become part of the earth. Here, the humans were after the minerals that are below Tree of Souls, and avatars wanted to protect that at cost of anything. Humans were winning, and finally Iva connected all these guys together, and nature's fury was unleashed on the human beings and they defeated them. And I was thinking, if in Avatar, this was connecting all of them, in the real world, how are we all connected to each other? Yes, we are connected to each other by the same microbiome that lives in all of us. Is the microbiome the real matrix human beings are living within, as in the Matrix movie, where the unreal world was within this coded matrix? Is this the world full of microorganisms that we are moving through them like filters? Who knows, right? The unknown is so much more, known is only this much. Okay, so I feel the balance of microbiome in different cavities and which the nature brings that health. Okay, the balance not because of the internal organs, but the balance of that of microbiomes. You know, today we use broad spectrum antibiotics, utmost practice of hygiene, where we want to be very, very clean and tidy without any microorganisms on our body. Dangerous disinfectants, 99.9% it kills everything. Sanitizers, we use that properly during COVID-19, and mouthwashes, they claim to kill 99.9 percentage of microorganisms in the oral cavity. They're making us like lab rats or nattobiotic rats, which are microorganisms free, and they do not survive. Compared to rats on the road, they don't live at all. They do not have immunity. So what I want to propose is the microbiome living with us, or are we living in the kingdom of microorganisms? Think about it. Thank you.
Thank you. That was indeed very, very interesting and thought provoking, something we can all think about. For now, let's go on to our next participant, that is Dr. Preetha Selvan. Can you please put on your, yes. Dr. Preetha, can you introduce yourself for everyone?
Good evening, everyone. I'm Dr. Preetha Selvan, Senior Lecturer from Raga Central College, Chennai, and we thank you very much for the opportunity.
Right. Thank you for being here. I shall now share.
AI is a clash of tradition and technology poised between relinquishing control to algorithms or forging a unique partnership, meddling human insight with AI's computational power to solve medical puzzles. Good evening, I'm Preetha Selvan here to decode the impact of digital technology on oral pathology with emphasis on AI. Digital technologies are revolutionizing oral pathology, offering new tools for diagnosis, education, and collaboration. Telepathology allows for remote consultation between oral pathologists and other healthcare providers. This can be especially helpful in areas with limited access to specialized care. Virtual staining is developing technology within digital pathology that utilizes artificial intelligence to analyze unstained digital slides and predict how they would appear if stained with specific dyes. This eliminates the need for physical stains and allows pathologists to virtually see different tissue components. Whole slide imaging allows pathologists to examine digitized slides on a computer screen instead of a traditional microscope. This can improve efficiency and accessibility as slides can be viewed remotely anywhere in the world. Virtual learning through social media such as X and Kiko for online educational resources such as lectures, simulations, and case studies can be used by students and professionals to learn about oral pathology at their own pace. AI currently has enormous potential to improve pathology practice by reducing errors and improving reproducibility. AI inference involves making predictions or decisions based on previously trained models and input data which differs from computers that just gives the output without the inferences. These inferences are made through algorithms such as supervised, unsupervised, and reinforcement learning, which work by taking in training data that helps the algorithm to learn. However, AI generates fabricated information in response to a user's prompt, but presents as if it is factual and correct. This is called as AI hallucination. The black box problem refers to the lack of transparency and interpretability of AI algorithms. As a matter of fact, it is difficult to understand how an AI system arrives at its conclusion or prediction. This poses a significant in the spectrum of AI, there's a promise of innovation and efficiency representing the good. Innovation drives progress and improvement, fostering creativity and efficiency. However, bias can distort perspectives, leading to unfairness and inequality. Orwellian surveillance, reminiscent of a dystopian control, highlights the dangers of unchecked monitoring, risking privacy and freedom. These elements encapsulate the dichotomy of advancement, cautioning against its potential misuse. Nearly all creators of utopia have resembled the man who has a toothache, and therefore thinks happiness consists in not having the toothache. This quote by George Orwell suggests that many visions of a perfect society or utopia are created by people who are focused solely on solving current problems or discomfort. In this analogy, the person with a toothache only desires relief from the pain and considers the state as happiness. Similarly, those designing the utopias often prioritize eliminating existing issues without considering the broader complexities and consequences, potentially leading to newer problems or limitations in the pursuit of an ideal society. The advantages of AI include efficiency, accuracy, elimination of human error, and automates repetition. Its drawbacks are bias, fake news, lack of empathy, and the black box effect. Combining AI's advantages and drawbacks with humans' emotional intelligence can facilitate the creation of the three C's: conceptualization, calibration, and commercialization for an utopian society. This fusion harnesses the strength of both, offering a balanced approach to innovation, adaptation, and prosperity in an ideal world. Plus, it can analyze thousands of slides in the time it takes us, mere mortals, to finish our morning coffee. So who knows? Maybe one day we'll all be taking medical advice from our robot overlords. Thank you.
That was also very, very interesting. And now we are with our next contestant, Dr. Yoita. As you might have noticed, he was in fact on the channel just a few days back and had a nice lecture. And just before we continue, I have to remind everyone the link for voting is there on top of the chat. So you will have to follow that. You will have to, well, fill it up and do finish all the rating and then close the form because you won't be able to revote again. Right. Okay. So, Dr. Yoita, what would you like to say to start off?
Good evening, ma'am. Good evening, everyone. I'm very much happy and a pleasure to be a part of this program. And I'm as well as I'm learning here and happy learning everyone. Thank you for the platform, ma'am.
You're most welcome. So far, we've had very, very interesting presentations.
Magic mirror on the wall. Who is the fairest one of all? This line was from a famous fairy tale, Snow White, which was exactly written 85 years even before the very first digital monitor was discovered. Today, we are enjoying digital India. With the digital revolution, it not only paved a way for a precise diagnosis, but also it has contributed much more towards a personalized medicine. So this modern digital workflow consists of the following phases: acquisition of information, processing that information, and clinical application on that patient. Among this, the first two phases greatly need the support of digitalization. Coming to the whole slide imaging, here the stained slide can be scanned and it can be used for the storage purpose, and also it can be utilized for telepathology purpose. The incorporation of AI in the field of oral pathology has been dramatically increased. This is just an upgraded or digitalized version of the image premier software what we are using today. And the recent paper cutting has brought a great astonishment where the Vivascope technology, which gives the report within very 5 minutes, which is called as instant digital pathology. In this, two lasers of different wavelength create two distinct images, one a fluorescence image and another one a reflectance image, where the surgically chopped tissue doesn't need to undergo any processing or staining procedure. So it directly reflects with this two different wavelength. It reflects H&E image, so through which the diagnosis can be made. And in today's digitalization scenario, so this dry lab analysis is obtaining more importance, where this through this protein interaction network, the functions of unexplored protein and interactomes can be built. Based on that, through pan-drug analysis, the drugs can be prioritized, and with the help of molecular docking software, this ligand receptor complex can be selected and a computer assisted drug can be designed. In this picture, you can able to see the protein interaction mapping. With that help, the protein interactome was built, and along with this, through the help of David software, the pathway analysis was done. So by keeping this as a base, with the help of pan-drug analysis, the drug of choice can be selected, and digitally this drug of choice can be checked for the purpose of its work and its binding efficiency and the place of binding things. And here you can able, this study has brought a great revelation which was recently published. You can go through it. So it says in 2030 there is going to be a definite involvement of the digital revolution and artificial intelligence in the field of diagnosis and personalized medicine. And yes, today upgradation is very much important. With the involvement of this digitalization and the digital technology, very soon we will be using this digitalization and the digital technologies for the betterment of human race. And definitely it is going to be for the healing of the human race. Thank you for the opportunity.
Yes, it is all about digital now, the digital word, and we are going to be a part of it. Rather, we are a part of it. And our next contestant is Dr. Ashuja RB, who, by the way, is my ex-student. So I'm rather happy to have her here. Not that I'm not happy to have everyone else here. Okay, that didn't come out right. But basically, you know how it is. Every one of you is a teacher, so you sort of know how it feels to have one of your ex-students around. It's just a different feeling. Right. So, Ashuja, how would you like to introduce yourself?
I'm Dr. Ashuja. I'm a senior resident from the College of Dental Science, Davangere. And my area of interest is role of nutrients in the oral disease, which is very important for our oral health. So we can improve the quality. And I would like to thank our Mandanama for this opportunity, and also our head of the department, Dr. Madhushankari ma'am, and our staff for supporting me. Thank you.
Right. So let's watch the video.
Role of the nutrition in the oral health and the diseases. Oral diseases are the most common causes of the chronic diseases. Oral health is the most important determinant of the oral health. So it can be impacted by the nutritional factors. Nutrition, it is defined as a intake of the food concerned in relation with the dietary needs of the body. It matters because the healthy diet is essential for the early phases of the development and the growth of the body. There is a synergistic link between the nutrition, oral health, and the general health. The impact of the nutrition on the oral health affects both positively and negatively. Healthy nutrition protects the oral health by promoting the growth, maintenance, the development, and also avoid some of the oral diseases. To help to protect the teeth, provide energy, give essential micronutrients to regulate the immune response and support the growth and the development. Poor nutrition, it negatively affects the oral health and cause the poor oral health, influencing the dietary intake, leading to the malnutrition. Insufficient supply of the carbohydrates, it will lead to the altered organogenesis, influence of the metabolism on the dental plaque, caries, and the periodontal disease. Insufficient supply of the proteins, it will lead to the atrophy of the lingual papilla, connective degeneration, alteration in the dentinogenesis, symmetrogenesis, altered development of the maxilla, malocclusion, linear hypoplasia of the enamel. An insufficient supply of the lipids, it will lead to the inflammatory and the degenerative pathologies, parotid swelling that will lead to the hyposalivation, degeneration of the glandular parenchyma, altered mucosal trophism. An insufficient supply of the micronutrients, it will lead to the dental organogenesis, the growth of the maxilla, and also the skull and the facial development. Effect of the diet and the nutrition on the oral health. Effects by causing some of the oral diseases like dental caries, that is due to the increased sugar consumption and the intake frequency. Sugar, it is immediately converted into the acid and it will drop the pH level. Periodontal disease occurs due to the increased carbohydrate and the saturated fats intake and also the decreased fibrous and the vegetable intake. This will lead to the pro-inflammatory diet that will regulate to the destructive inflammatory mechanism. Oral cancer occurs due to the increased alcohol consumption, that is due to the presence of acetaldehyde, which is a toxic metabolite causing the disruption of the DNA synthesis and also the repair of the oral tissues and leading to the oral cancer cascade. The tooth wear occurs due to the decreased pH, that is between the 2 and the 4, and the increased consumption and the frequency of the intake of the acidic food and the beverages. Impact of the oral health on the diet and the nutrition. Oral diseases will cause the pain, tooth loss, and the infection. Infection, again, it causes the increased systemic inflammation, and with the help of decreased protein intake, it causes the sarcopenia, which is the weakening of the muscle mass and the muscle strength. All this in turn will lead to the decreased chewing efficiency, and that will alter the nutritional intake, leading to the malnutrition. Oral health and the nutrition through the life cycle, and it occurs due to from the gestational period to the end stage of the life. If proper diet is there, it will provide the growth, development, prevent disease, and promote the health, and also prolong the life.
Yes, thank you. Let's go on with the next. And where's everybody? Yes, okay. Yes, next is Dr. Abhishek Banerjee. And how would you like to introduce yourself?
Good afternoon, everyone. Good afternoon, ma'am. Myself, Dr. Abhishek. I'm currently associated in our Dental College Hospital, Jamshedpur. I also have my own oral path lab. My key point of research interest as of now is mitochondrial DNA mutations, and I'm working on few projects related to artificial intelligence, like creation of database, along with the other computational engineers. So thank you for giving me such a platform to speak on my topic. Thank you, ma'am.
You're most welcome, and it is our pleasure. So,
A very good afternoon, everyone. The topic of today's presentation is the impact of digital technologies on oral pathology. Myself, Dr. Abhishek Banerjee, I am very thankful to Senior Professor Dr. Mandana ma'am and other co-participants for giving me this platform to speak about this particular topic. And this is a very important topic when we are talking everything digital. So why not digital pathology? Digital pathology is something management of this digital imagery taken from this microscopic slides. And this will only enable us to share across the scientists or across our peers by the computer technology to know about more about the diseases and more about the field. And this can be attributed to way back when we started sharing the images, and this has only led to the emergence of the telepathology. The whole principle behind this digital pathology is formation of whole slide imaging, that is conversion of a glass slide into a very high resolution digital image, facilitating the exceptionally brilliant data storage, effortless sharing, and advanced analysis capabilities. The noteworthy applications being the digital archiving, telepathology, consultations and revisions, educations, panel discussions, research, and automated image processing. And it all lead to the clinical care. In big conferences, there is no need of multi-headed microscopes, quicker preparation of meetings, and clinico-pathological conferences can be done very smoothly and efficiently. This is a slide which shows how an area of interest can be digitalized and can be stored in the form of a DICOM file and can be used clinically and rendered to the reports. These terminologies are little alienating to us, to the pathologists, that is the artificial intelligence, machine learning, and deep learning. But deep learning is something like the deeper subsets of an image, which leads to the formation of the machine learning and create artificial image banking. This is how we can see the small subsets can lead to the formation of an elephant. This is a very important, this is how this image predictions are done. The textural patterns help us, enables us to create or to identify the stains or the particular area of interest, the pattern, the staining pattern, and classify them into the particular domain. This is when a particular high risk malignancy by a pathologist who is having a doubt can digitalize the site, take the oncologist's data, patient's data, put into the deep neural networking, and lead to an output which can help the AI based deep learning approach based to give the predictions for particular accurate diagnosis. This is an older review which has been published me at my postgraduate level, and where we can find the cellular and the nuclear fragmentation is very much needed for the automatic slide diagnosis. This is how the nucleus is chosen, and then further it is blocked into particular tessellation areas, and this can be further done for the image classification based on a particular site recognition and help for the disease prediction. This input image, then the stain is recognized, morphologies are recognized, connected together, stain locations is done, whether it is a nucleus or a cytoplasmic, and further the image prediction is done. The important points for the dataset creation being the pattern recognition, tissue-based identification algorithms, stain recognition, and stain-based algorithms. This all leads to a storage management where we can store. This is a very high storage, that is almost 120 TB, and it can be having a very transparent archiving and retrieval. Access time is also very less. The applications being creation of a tumor board, detection of a particular area of interest, and also quality management. This all things comes together when we want to predict an oral cancer, and this is a very booming topic, and we need all this data, that is the clinical, radiological, histopathology, compare with the model, that is a comparative model, creation of a data set, and that needs a constancy and standardization. This is the older review that have been written. I have extracted few images and I've already showed. And these are my few researches which have been accepted, yet to be published. You can easily access. We need more collaborations for creation of this digital pathology, creation of a data subsets, and creation of artificial intelligence. Thank you so much.
Thank you for that nice presentation. With that, let me just remind everybody, please follow the link which is on top of the chat to go and vote. Remember, the purpose of the open mic was for you all to vote for the next, for one of the guest speakers at the International Oral Diseases Case Presentation Conference. And with that, let me bring in our next contestant, Dr. Sumukh Bharadwaj. Are you there? Can you please put on your camera? Yes.
Yeah, hi.
Okay.
Hi everyone, this is Dr. Sumukh Bharadwaj. Hi Mandana ma'am. I'm a postgraduate student in the Department of Conservative Dentistry and Endodontics at JSS Dental College and Hospital. So I feel I'm the odd one out because I belong to a different stream. I'm not an oral pathologist. But my interest in oral pathology is due to, I believe that diagnosis is a key to clinical success. So oral pathology is one of the main streams, and that is why I chose to participate in this particular program. And I wish everyone best of luck and good luck. So thank you, ma'am, for this
Yes, I
opportunity.
have to remind you that, of course, the competition was not open to students. Still, I left your presentation inside because I found it interesting, and I found it very interesting that you would like to take part.
Thank you,
So,
ma'am. Thank you so much, ma'am,
yes,
for this
and
opportunity.
we will hear your presentation now and come back.
Now let us begin with the introduction. Artificial intelligence is set to revolutionize medicine and pathology, with digital pathology becoming increasingly important. Advances in computer resources, faster networks, and affordable storage enable pathologists to manage the digital data and share the slide photos for telepathology and clinical use. Digital pathology, which involves creating virtual slides using 4 slide scanners, has been in development since 1960. So the growth in digital pathology extends to oral pathology. Basically, artificial intelligence or the digital pathology consists of 3 important steps. We have artificial intelligence, which is a program which can sense, reason, act, and adapt. Machine learning. So these machine learning, we use algorithms whose performance improve as they are exposed to more data over a period of time. And we have deep learning, which is a subset of machine learning, in which there is a multi-layer neural networks which learns from vast amount of data which is available. And hence, we shall move forward with the other aspects of artificial intelligence which were used in the field of oral pathology. Now, we have telepathology. Basically, telepathology enables a faster diagnosis where patients in remote rural areas can be tested and diagnosed in a single trip to the nearest healthcare facility and avoid the travel to a larger center, which is required often more than once. For example, for initial assessment and other investigation on the date of the biopsy procedure, and later for results and ancillary procedures, which is prior to definitive treatment. So this could be one of the examples. And this delay in diagnosis can sometimes be very fatal. So this is not uncommon in traditional pathological systems due to logistical difficulties of coordinating the transfer of a particular patient. So telepathology, it overcomes all these difficulties, and the main categories which include static image-based systems where images are captured from digital camera and are connected to a microscope. An image area is selected and then it is transmitted. So we have the virtual slide systems where pathology specimens slides are scanned or videographed and high-resolution dental or digital images are created for transmission. We have real-time systems where the operator remotely guides a robotically controlled motorized microscope, and the consultant pathologist has complete control and can adjust the slide position, zoom, etc. so that the area of interest, whichever area is interesting to him or which is the area of concern, is brought under view and transmitted. And the whole slide imaging or WSI system, where digitization and scanning of a glass slide takes place, in order to generate a large size digital image which can be viewed in parts in a manner which simulates microscopy. So what are the benefits of telepathology? We have medical professionals in different locations. They can view the images simultaneously and they can discuss diagnosis through teleconference, as we discussed before. A doctor can consult with a pathologist who specializes in the patient's area of concern. So, for example, you could say oral cancer, lung pathology, any pathology it could be. A healthcare provider can get second opinions more easily, and patient data can be synchronized across various electronic health information systems. And once implemented, a telepathology system is less expensive to operate than the traditional system. So both telepathology and teleradiology are image-intensive branches and are highly intended, especially in this particular generation. Coming over to the most revolutionizing aspect of digital pathology, that is LIMS, Laboratory Information Management System. Basically, what is LIMS? A laboratory information management system. It helps you with large volume lab data management and adherence to strict standards while improving efficiency and turnaround times, which enables automation and more. And one of the main features which set this particular LIMS systems apart is a set of configuration tools which are specifically designed to efficiently create optimized, highly adaptable workflows. And the flexibility of this particular software and its various modules enable it to be used in a variety of laboratories, both in terms of size and application. So the main purpose of LIMS is to improve the lab efficiency, quality control, and accuracy by reducing the manual operations. And the advanced LIMS systems will perform a range of core functions which will assist our daily work and long-term projects, enhancing all areas of laboratory works. So what are the benefits? We have the workflow automation, real-time tracking and time saving. It shows improved data quality. It meets the regulatory compliance interfaces with instruments, and basically it also improves our turnaround times. So it contains basically platform which consists of electronic lab notebook, lab execution system, then scientific data management system, artificial intelligence, assessment planning, then consumables management, sample monitoring, which is environmental sample monitoring, and finally we have incident reporting, that is lab investigation. So this particular software, you just don't need to be technical to use this particular software, because the new LIMS system, it stands apart from the competition thanks to the superior flexibility. There is no custom coding which is required, which means any user can configure this particular matrix workflow, screens or menus to create their ideal configurations. Thank you and have a great day.
Right. So I have to clarify one couple of things. First and foremost, if you are finding that the resolution is too low, especially if you're watching from a mobile, some of the slides may not be clear. Please remember that you can improve this settings. They improve the resolution by using the settings wheel and choosing a higher pixel, a higher resolution DPI picture from your settings. And the next is our next contestant, yes, and that would be Dr. Sri Chinthu. Hello, where are you? Yes, yes. Hi.
Hello, ma'am, and hello, everyone. I am Dr. Chinthu and currently associated with KSR Institute of Dental Science. And thanks for this opportunity.
You're most welcome. Okay, here we go.
Hello, everyone. Here I am to present on the topic, the role of nutrition in oral health and disease prevention. Generally, we get nutrition from the food we eat, and the importance of food has been foretold in the scriptures. And one of the very famous prayer which has been portrayed in the scripture, which says that, give us this day our daily bread. This actually signifies the importance of food and the nutrition in our day-to-day life. And this is again well portrayed by one of the famous Greek physician named Hippocrates, who has been considered to be the father of the modern medicine. He has also stated that let food be thy medicine shall be thy food. So knowing the importance of nutrition and the food, the World Health Organization has stated nutrition to be a critical part of health and development. The nutrients, which are the constant of food, they are necessary for the normal functioning of the body, and nutrients are generally referred to as micro and macronutrients, where micronutrients refer to vitamins and minerals, and macronutrients, they refer to the carbohydrates, protein, and fat which the body needs. And nutrition is very important for the growth as well as for a day-to-day activity even before the birth, that is in the intrauterine life. And if there is any deficiency in the nutrition, it leads to any disorders or any disease in the human life. So let us now see how this nutrition has got its impact in the oral cavity or in the oral health. Scientific researchers says that nutrition is considered to be the integral component of the oral health because there exists a bidirectional relationship between the oral health and the nutrition. Early signs of suboptimal nutritional status are first seen in the mouth, and that is why the oral cavity is considered to be the mirror of nutritional status. If there is any impaired maternal nutrition or malnutrition in the early childhood, it leads to enamel hypoplasia as well as the atrophy of the salivary gland, resulting in diminished salivary flow. So that by resulting in the development of the dental caries even at a very young age. And one of the common problems faced in India is periodontal diseases. So though there are many causative agents for the occurrence of gingivitis and periodontitis, one of the major factor or major etiology for the occurrence of gingivitis and periodontitis is considered to be the malnutrition, which will definitely result in the compromised host defense response. And apart from that, various vitamin deficiencies, especially vitamin B complex, C, A, and D, has got its oral manifestations in the form of stomatitis or angular cheilitis, glossitis, gingival bleeding, or aphthous ulcer. So, when looking into the data regarding the nutrition, the WHO has stated that globally, nearly 1 in 3 people suffer from malnutrition and diet and lifestyle related diseases. And UNICEF has also warned that poor diets are significantly harming the health of the children. So, considering these, the United Nations has labeled the decade of 2016 to 2025 as a decade of action on nutrition. We, the Indians, should take a privilege regarding our Indian traditional food because Indian traditional food are recognized as the functional foods because of the presence of functional molecules or functional compounds. But in this generation or in this era, the Indian traditional foods are slowly replaced by the modern foods like fast foods and so on. The Indian traditional food nowadays just looks like a tip of an iceberg where it has to be like explored for the proper nutrition. Why? Because the recent index, that is the Global Hunger Index, which is given in 2023, they have stated India ranked 111th position out of 124 country, which actually reflects the acute malnutrition that is happening in our country, India. So, considering these facts, we need to improve nutrition and oral health. So, for that, the government as well as the medical and the dental professionals should come forward for creating an educative or the awareness program regarding the proper health and healthy lifestyle. And there is an urge for the government to instruct the private sectors or the industries for the unbiased labeling or advertising of food. One of the famous quote given by Jack, who is considered to be the father of the fitness, he has stated, exercise as a king and nutrition as queen, put them together and you have got a kingdom. So let us eat right and stay fit and let our food become our medicine. These are my reference and thank you.
Yes, very, very nice. Lots of new things, lots of thought, lots of things to think about this evening. So next with us is Dr. Kavitha. Oh, nice to see you. You made it. Okay. Right.
Hi all. This is Dr. Kavitha. I'm currently working in Ragas Dental College. Thank you, madam, for giving this platform for us to voice our choice of topic. And it was really a fun time preparing and even presenting for it. Thank you.
You are most welcome. It is fun watching all the videos, I must say.
A very good afternoon to one and all. Smart or fat, strong or weak, the bug decides. So it's important for us to know we are not living alone. There are trillions of organisms, bacteria, viruses, and fungi which reside within us, constituting what is known as the human microbiome. The highest number of commensals present in the gastrointestinal tract, followed by a diverse range of organisms that inhabit the oral cavity. The whole microbiome includes a wide range of bacteria, viruses, fungi, protozoal organisms, archaeal species, but they are all affected by or regulated by factors like age, host and environment, habitat, and the biofilm maturation. These communities, bacterial communities, will vary among the oral mucosal surfaces itself. They are different in the tongue, they are different in the teeth, gingival crevice, subgingival plaque, and the buccal mucosal surfaces. Similarly, the gut microbiome has four predominant bacterial phyla: Firmicutes, Bacteroides, Proteobacteria, and Actinobacteria. Symbiosis simply denotes the complex equilibrium of the relative proportion of organisms present in the state of health within the organ. So, analogous to it, a disease state is represented by dysbiosis, as in the case of periodontitis, oral precancer, cancer, or simply poor oral hygiene, very bad oral hygiene, exposure to carcinogens, mutagens like tobacco smoking, alcohol, erector nut chewing, and in gut dysbiosis can occur in case of decreased short-chain fatty acids, increase in lipopolysaccharides resulting in immune dysregulation and chronic inflammation. So the eubiosis of the gut microbiota is controlled by its communication with various organisms in the body. And this disruption in this equilibrium will result in various systemic disorders, starting from neurodegenerative disorders, inflammatory bowel disease, atherosclerosis, cardiac diseases, lung cancer, obstructive pulmonary diseases can occur when the gut-lung axis is disturbed. Psoriasis, acne vulgaris, skin cancer can occur when the gut-skin axis is disturbed. Oral microbiome can get translocated to the gut through the oral gut axis, having a significant impact on the well-established effects of the gut on immune dysregulation, systemic inflammation, and eating behaviors that occurs through the gut-brain axis. And it can also have an effect directly on the adipose tissue through the blood, that is through the oral blood axis, resulting in obesity. The other way is directly, it can have an effect on the lingual taste receptors, altering the taste perception, which in turn is regulated by metabolite production in the tongue coat, altering the food preference of the individual. Once altered, this will in turn impact the oral microbial composition. This is a vicious cycle. So this shows the influence of oral microbiome in obesity. Obese individuals, interestingly, had more firmicutes in their gut or gastrointestinal tract and 90% fewer bacteroides than the lean individuals. When obese volunteers consumed low-fat, low-carbohydrate diet for a year, they lost 25% of their body weight and the proportion of firmicutes dropped. On the other hand, bacteroids increased. This emphasizes the role of gut microbiome in obesity. So, oral gastrointestinal carcinogenesis mainly occurs by the oral microbial dysbiosis being one of the factors. What happens here? There is chronic inflammation, oncogenic metabolites being generated, epithelial barrier is altered, and epigenetic modulation occurs. Tobacco smoking, alcohol consumption, betel nut chewing will decrease the protective bacteria like Neisseria and Lactobacillus. So these are the list of bacteria which are increased both in OPMDs and squamous cell carcinoma. As I told, Neisseria, Lactobacillus, protective bacteria are decreased in these carcinogenic conditions. Bacterial profile in oral cancer and gastrointestinal cancer. So the question in mind now, how do we combat it? How do we combat this disequilibrium? This is possible by appropriate intake of natural food along with good amount of prebiotics and probiotic containing food. Prebiotics are non-digestible compounds in our food that feed the healthy gut bacteria. And probiotics are living microbiomes, microorganisms that when consumed may benefit our health. So these are the list of products. Should consider consuming these products regularly. So I conclude by quoting the statement by Robert Ulrich, a healthy outside starts from inside.
Thank you. That was very interesting. I really should meet the person who called those firmicutes name. If I had to call something, I probably would have called it something like that, but this is very interesting. Okay, let's go on with our next participant. And I believe our last participant, Dr. Shruti. Yes.
Hi,
Shruti.
everybody. Hey, man. This is Shruti. I'm a practicing oral pathologist and also a medical editor with EditChecks LLC. Now, I don't know, I might sound the most monotonous being the last one here, But somehow I hope I'm going to stick to the basics and give you all a good presentation. But bear with my bad voice. Flu has caught up with me for the past 10 days. I'm very sorry about that. But thank you, ma'am, for giving me this opportunity.
You are most welcome, my dear. Yes, let me find your presentation.
Welcome, delegates, and thank you for joining today's enlightening journey into the invisible microbial community residing within our body and playing a crucial role in systemic health, the oral microbiome. The term microbiome was coined by the Nobel laureate Liederberg to describe the ecological community of commensal symbiotic and pathogenic microbes, including all the enlisted bacteria, viruses, and fungi. Now, they play a crucial systemic role in maintaining the balance between health and disease through their interactions with each other and with the host. The mouth presents diverse habitats like teeth, gingival sulcus, attached gingiva, tongue, heart palate, which form a heterogeneous ecological system where different microbial communities thrive in symbiosis, playing vital roles in metabolic, physiological, and immunological functions. How do we acquire this oral microbiome? Primarily from the mother by the transmission to the child during birth. So the mode of delivery and the feeding methods could influence the early microbial colonization, followed by the teeth eruption, which marks a significant ecological shift, leading to a complex oral microbiome by the age of 3. Now, a dysbiotic microbiome is one where the relative proportion of these species get disturbed. Now, in health, the majority of bacteria will have a symbiotic relationship with the host. Now, they're all represented in green. And you also have these pathogenic bacteria which have been detected at healthy sites low levels, but they're not clinically relevant. We can find them marked in red. So, what happens with the modifying ecological environment? Probably a reduced pH or increased inflammation, they begin to proliferate and lead to what is called oral dysbiosis. Now, what are the local implications? In caries, the carbohydrate fermentation to acids, example lactic acid, lowers the pH, which causes demineralization and favors the acid-resistant bacteria. So what happens is when the demineralization outweighs the remineralization, that's when the net mineral loss results in cavitated enamel lesions. The theories on plaque's role has also evolved from non-specific plaque hypothesis, highlighting the transition to gram-negative anaerobes contributing to chronic inflammation. Now, once the bacteremia sets, that is the systemic dissemination of oral bacteria, the plaque and its metabolites could impact systemic health by entering the bloodstream, and that has been postulated by Miller and Frank Billings. So they are associated with a range of chronic human diseases, which a few of them which we'll be seeing now. Coming to inflammatory bowel disease or IBD. So what happens is the adults, we produce around 1,000 ml of saliva each day. So they have a lot of oral pathogens which are not native to the intestinal gut. So when they enter there, they break the barrier and induce systemic inflammation. So what happens is they inhibit the T cell mediated immune response and exacerbate the inflammatory bowel disease. And again, time and again, the studies have proven that organisms, especially P. gingivalis, is a risk factor for non-alcoholic fatty liver disease. So once they reach the intestinal flora, what happens is they create the dysbiosis, they increase the mucosal permeability, reach the liver, and boost the liver triglyceride content. Now, the oral microbiome plays a role both in carcinogenesis and tumor progression and invasion and metastasis. How does it do? By influencing inflammation, DNA damage, and modulating post-immune responses. So why is this necessary? Is because they help in detecting targeted drugs by understanding their interaction mechanism. The involvement of microbes in cancers beyond those of the oral cavity, such as pancreatic, esophageal, or colorectal cancer, has been recognized, but given the extensive scope of the subject, it's impractical to comprehensively cover them, within the limited time given. So what happens is once the oral local inflammatory response happens, they've reached the local immunity. They set the stage for systemic autoimmunity. So they mislead the immune system and lead to a cascade of reactions which manifest as autoimmune conditions such as the systemic lupus, your rheumatoid arthritis, and the Sjogren's syndrome. Periodontitis and CVD, yes, so the inflammation, the systemic inflammation, and the endothelial damage will pave the way for atherosclerotic scar formation with related bacteria promoting inflammatory factors that worsen the vascular and systemic health. Now, there is something called type 3 diabetes where you have diabetes, periodontitis, and Alzheimer's. So, what could happen is you could have a weakened barrier, blood-brain barrier with aging, where these inflammatory cytokines reach the brain, or probably they reach the CNS directly through nerves such as the glossopharyngeal or trigeminal. You also have the additional entry points to the ventricular tissues because they are all located outside the blood-brain barrier. And the bidirectional relationship between diabetes and periodontitis, we very much know as to how the sustained inflammation causes the P. gingivalis endotoxins to exacerbate the insulin resistance and disrupt the blood sugar regulation. Now, during pregnancy, the shift in hormones will also shift the microbial flora, but when real trouble happens is when the oral hygiene is not maintained. They reach the placenta and result in adverse pregnancy outcomes such as low birth weight infants, preeclampsia, or even miscarriages. Now, with the advent of NGS and metagenomics, the study of microbes has been facilitated. Throughout human evolution, our environment has continuously shaped the composition of microbiome, with industrial revolution, probably with the use of processed foods, refined sugars, and the advent of antimicrobial therapy. The oral microbiome is now one of the top 5 research priorities of the magnum opus Human Microbiome Project. So, what does this mean? The oral microbiology's evolution from focusing on individual bacterial pathogenicity to examining its connection with systemic health highlights the critical role of maintaining our oral microbiome not merely for dental wellness but as a fundamental aspect of overall well being. So, these are my references. And thank you for
put on their cameras. That was the last one. And thank you. Those were really nice and interesting. Lots of questions answered, lots of thoughts to take home, lots of things to think about now. And for the audience, if you found some of them speaking too fast, that would be my mischief because I have increased the speed because they were slightly over 5 minutes and I had very strict no over 5 minutes time because actually even in the conference we are not going to be going beyond the time. If anyone attended our last conference knows that all speakers were very strictly following their time schedule. So if you did find any of them speaking too fast, that was really me and couldn't be helped. So I guess it's all happening. People are voting. I can see the votes coming in. But in the meanwhile, tell me we'll just take a few minutes and chat. Yes. So tell me, what was your experience? What did you feel? Was this a good idea having an open mic?
Absolutely. It just makes us
Absolutely.
and great topics. And congratulations to all the speakers. You added a lot of matter and thanks for the information. Wonderfully presented. Thank you.
That is very true, yes.
Very thought-provoking presentations, ma'am. And congrats, Dr. Bharadwaj, for your presentation.
Thank you, sir. Congratulations,
Yes.
everyone. It was a thought-provoking process. And I can see all great pathologists here who have done great things in this field. So I do not know much about pathology, but I wish all of them good luck. Thank you.
No, that was great. And any which way, don't feel disheartened because actually every one of these now I'm going to make them into 5-minute presentations and keep them on the channel individually. And I guess Dr. Bharadwaj has no reason to be familiar with Oral Pathology 360, but it is a collection of over nearly 200 videos now. We have a good, and because every lecture is by an expert, it's not me giving all the lectures. So by experts from around the globe. So we have good viewership. So you are going to be the first non-oral pathologist, non-oral medicine person who's going to be on the channel.
That's great.
Thank you so much. It's an honor.
Yes. Yes, we appreciate your enthusiasm. Totally appreciate it. Yes. Right. Okay, so yes, so that was the news for all of you. I will be breaking up all these because they were really all very interesting. So were the ones in the last. So then I thought that I should share them individually because like this, people won't know what the talks were. It will stay as one video, one single video, which is the contest, but I will also break them up so they have their own titles and they can be found when people do a search on the topic. So that will be very nice. And for our audience watching, anyone wants to say anything? Let me see, what did people say? So of course, there were a lot of hellos. Dr. Krishali is there with us. She actually won the last one. Hi. And Dr. Madhushankari is of course here because of Ashuja. Hi, Madhu. Dr. Krishna also was with us last time. Then TRICARE, Dr. Bhuvan is here because, of course, like he mentioned, 4 of the POPMA members are there today. And for everyone who doesn't know what POPMA is, it is the Practicing Oral Pathologists and Microbiologists Association. And did I get that right?
I think so. Yeah.
Okay. So that just focuses on basically the practice of oral pathology, and it is with a lot of interdisciplinary members. Then we have Dr. Pratibha with us, and we have nature, travel, and photography. I have no clue. Well, hello. I hope you found the talks interesting. And Dr. Raja Chakrabarti, Dr. Prasad. Oh, hi, Prasad. And yes, all very nice. And we've had good viewership also. And there are people still watching, of course, because some would have joined later. And reminding everybody that to remember the main purpose, and you have to now register for the conference so you get to watch the two winners actually speak in the conference. And the registration is open. Everything is on our website. You go to oralpathology360.com, and it's not really difficult. On the home page, you will find the link to go to the relevant section. And the conference is really open for anybody with an interest in oral and maxillofacial diagnostics. Anybody, dentists, non-dentists, any branch of medicine, any specialty of dentistry. All that we want is that you have an interest in the diagnostics. And well, with that, I guess we are done. Anything any of you want to say before we go away?
Actually, ma'am, this is a good platform, like all like-minded people, like we have chosen our topics. So it is not just presenting reviews. Actually, we will come to know what other people are thinking. So we can actually collaborate. So we are from different, I am from East, Yoithap sir is from South, Bhadranna sir is from Karnataka. And I've already messaged Gowthami ma'am for the information for her company. So this is actually how we come to know. And this is a one platform, like there is no time pass, and thing is like we are all interested to do something pertaining to our field. So all thanks to you, ma'am. Lots of effort from your side. Yeah, we have done a lot of retake of our videos, but yeah, I came to know a lot of things. Yoithap sir has helped me out. And
Yes.
thank you so much, ma'am, for upholding the stream like this single-handedly.
Thank you. It's all in the spirit of what we are about: education, awareness, and collaboration. So
Yeah,
it's all
thank you so much.
fulfilling that.
And thank you all the participants. It was a great day.
Yes, it was. Thank you all for being with us. And I wish you great success in whatever you're doing. I know you will do very great things. And never mind, if you are not the winner this time, you will be the next time. Yes. And we'll see you.
Sure, thank
So,
you.
welcome.
Bye bye.
Thank you. Bye. Bye, everyone. Bye.
Bye.
Thank you.
Bye,
Bye.
everyone. Thank you.
Bye. And don't forget to join us next Tuesday for a lecture, for our regular lecture. Every Tuesday, we are live on very interesting topics. So join us. And if you subscribe to the channel and put on the notifications, you will know what's happening. And of course, you can also follow us almost everywhere with the same handle at Oral Pathology 360. We are on Instagram, on Facebook, on LinkedIn. Of course, there's a channel on YouTube. And also on WhatsApp, we have a channel, and everywhere you will get all the information. Thank you again, you lovely people, for being here, for presenting. Thank you for everything.
Thank you for inspiring us, ma'am. Thank you. Bye.
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 Bye.